You're thinking about having a baby, and there's a question came up to your mind. Am I able to conceive, or am I infertile? And some people who's not planning to get pregnant soon might be just curious. And I think this is the right question to ask yourself, because knowing if you have any problems with your reproductive system will help you to get pregnant quicker, because you could work on this problem even before trying to conceive. And it also will make your journey to parenthood less stressful in the future. So that's why in this video I want to tell you about red flags that you should look for to know whether you have any problems with your reproductive health. I would recommend to watch this video up till the end, because I'll give a tip on how to get pregnant fast and naturally. And also I would recommend to watch this video even for people who are not planning pregnancy. Because anyway, we are talking about symptoms, and if you have them, you need to go and see a doctor, whether you're planning pregnancy or you don't. Well, I think people who are not planning to become parents wouldn't find this video by themselves. So you can share this video with your friends or family members if you care about them and want them to be healthy too. Well, first one is irregular menstrual cycle. Menstrual cycle is a period of time between the first day of your menstrual bleeding and the first day of your next menstrual bleeding. From cycle to cycle, this period could vary a little. One month you might have a 28-day, and the other month you might have 30-day cycle. It's not considered to be irregular. Irregular is when your menstrual cycle is shorter than 21 and longer than 35 days, and this might be a sign of anovulation. Excess hair growth on your body or face in a male-like pattern is also known as hirsutism. That means that you might have thick and dark hair in the areas where females usually don't have hair growth. People might have different opinions on what is usual and what is excess hair growth. So to quantify hirsutism, we use a Ferriman-Galway score. In the method, we rate hair growth in non-body areas, which are upper lip, chin, chest, upper and lower back, upper and lower abdomen, upper arms and thighs, and we are rated from 0 to 4. Ferriman-Galway score of 8 and more is considered a diagnostic of hirsutism. Acne, hirsutism, and hair loss might be a result of high androgen level and a symptom of PCOS. And it's harder for women with PCOS to get pregnant because of irregular menstrual cycle and anovulation. Hair loss might also be a sign of thyroid disorder. Heavy period may be caused by endometrial pathology like uterine polyps or by fibroids. Both of these pathologies can make some difficulties for fertilized egg to attach the uterine wall, or both of them could block sperm from entering the uterine or fallopian tubes, and it will depend on their location. All kinds of pelvic pain, like chronic pelvic pain, pain during sexual intercourse, painful periods, could be a sign that you might have adhesions, which is blocking your fallopian tubes, or be a symptom of endometriosis. The release of fluid from the nipple could be caused by a high level of prolactin, and as well as thyroid disorder and high androgen level, it could lead to anovulation. And now let's take a look at your medical history. First thing we want to know is if you had any surgery done on your reproductive organs. It's obvious that if you have your uterine or both of your fallopian tubes or both of your ovaries removed, you can get pregnant naturally. The other thing that could cause your fertility problem is if you had surgery on your ovaries, because it could cause a diminished ovarian reserve, which is decrease in the quantity and or quality of eggs. Also, any pelvic surgery might cause adhesions, which can block fallopian tubes. The next thing we want to know is if you had any pelvic inflammatory diseases or sexual transmitted diseases, because it also can cause adhesions or chronic inflammation. When a girl born, she have around 2 million eggs. When she reach puberty, she have around 400,000 eggs, and by the time of menopause, approximately 1,000 eggs left. So the older we get, the less egg cells we have, and it's getting harder to conceive naturally. Being over or underweight can affect your fertility by blocking ovulation. But what does it mean being over or underweight? Well, we need to know your body mass index, which is weight in kilograms divided by the square of height in meters. Now you can see a formula on the screen, so pause this video and calculate your BMI. If you're from 18.5 to 24.9, there's nothing to worry about. Your BMI is perfect. If you're under 18.5, that means you're underweight. If you're between 25 and 29.9, you're overweight, and you're obese if your BMI is more than 30. Now, when you know what is BMI, you can find out what is your perfect weight, and you can go for it in purpose to improve your health, reproductive function, and to prevent some diseases. Stress can make your prolactin level increase, and as we already know, high prolactin level can be a reason for anovulation. Also, stress can cause hypothalamic dysfunction and imbalance of FSH and LH. Those are hormones which stimulate ovulation each month. So there's another reason for anovulation, and that's why stress is another red flag for fertility problems. But what if you don't have any of those red flags, and actually you and your partner recently had a medical checkup, and both of you are quite healthy, but you're trying to conceive, and let's say for a few months, and you haven't gotten pregnant yet? Is it something to worry about? Let's start with the definition of infertility. Due to World Health Organization, infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular, unprotected sexual intercourse. So not to get pregnant during the year of trying, it's okay. But if you're 35 years or older and have tried to conceive for 6 months or longer, then you already need to go and see the doctor. What do you need to get pregnant? Of course, you need 2 cells. One male cell, which is sperm, and the second one is female egg cell. And every day, a healthy adult male can produce up to 150 million sperm. But for female, it's a more complicated process, so women can produce only 1 egg cell per month. Yes, sometimes there can be 2 egg cells per month, and that's when women can get pregnant with twins, but as we know, that's not really common. The moment when egg released out of the ovary is called ovulation. After ovulation, egg lives from 12 to 24 hours, and only at this time pregnancy could happen. We have only 24 hours per month to get pregnant, and some eggs can live even less. And sometimes anovulatory menstrual cycles can occur even in healthy women of reproductive age. So there's no wonder that you might wait for pregnancy up to 1 year. Actually, the fertility window is more than 24 hours. It's about 6 days because sperm can live in a woman's body for 5 days. This means that you can have sex 5 days before ovulation and 1 day after and still be able to get pregnant. But you could miss fertility window if you have irregular sexual life and long intervals between sexual intercourses. Try to have sex every day or every other day during fertility window. If you don't like or you can't have sex every day, do this 3 days a week. Start right after the end of your period. This will increase your chance to conceive because you wouldn't miss your fertility window. Well, as I said before, if you have any symptoms, you need to make a doctor's appointment. It doesn't matter if you're trying to conceive or you don't. And I believe that if you have any questions about your health, you need to go and ask your doctor about it. Thank you for watching this video. I really hope to see you in my next one. Bye.